I've been a clinician, physical therapist for over 20 years. So I was really intrigued when I was asked to look at this heel pressure relieving AFO, because being familiar with EHOB and kind of having a sense of their company philosophy with their products, I wanted to see if the product would do several things. And one was, would it be within the cost, would it be reachable for the patient? And the other thing I was looking at is, did it cross the continuum of care? Meaning, would it work for somebody in the acute care setting as well as the extended care setting and even possibly the home setting? And then the third thing I was really looking at was, did the product do what the company said that the product would do?
It's an offloading device first and foremost. So when we open this product up, splinting is certainly there, but instead of using a splint to actually do the offloading, we use a gel air pad within the confines of this piece. So this piece here is really the magic to it. It's what offloads that heel.
It's a heel pressure relieving ankle-foot orthosis, and what that means is that it's actually providing some stability to the ankle.
And inside this cushion is the actual gel pack, and it's ideal for the skin or the body to be floating on a fluid surface. So whether that be air or a liquid, it's ideal in the sense that it won't allow for constriction of the blood vessels from impingement from any kind of firm or hard surface. For patients who like to lie on their side, with the other products, there's really no protection for their malleoli, which are the ankle bones basically. So you have to worry about, if a patient were to lie on their side, that they may get a wound on that area as well. So we're always worried about the bony prominences, and these ankle wings help protect the patient there as well, which I'm not aware of any other product on the market that can do that. So if you want to go ahead and sit on the side of the bed.
What happens sometimes is a patient will push down into what we call plantar flexion, and because of that, in the devices that have a harder shell, their heel actually slides upward. And so because of the rigid nature of the shell, they will develop an ulcer on the back of their ankle.
Probably the second really magic piece, or what I think is is one of the best features of this is it in an ambulatory mode. And if I want to take this off, that's what I would use in bed.
Sharon and I have both walked in a lot of the competitor products and this is much more comfortable. The functionality in walking is really nice with this product. I feel like you get a more natural gait pattern than you might get with some of the other products. On the back of the boot is this anti-rotation bar. And basically, what this does is, if a patient's lying in bed, this keeps their hip from rotating inward or outward. And this is important because if you're in bed for a long period of time, your muscles on the inside or outside of your hips can get weak. And so we really need to keep that hip in neutral alignment, or what's optimal for that person, so that when they get stronger and they can get up and walk, they won't have any abnormalities. As far as I'm concerned, you know, there's a lot of products on the market that supposedly offload the heel and provide good pressure relief, but what I think that they've been missing, as far as for my needs as a clinician, is to protect the skin elsewhere, and I think that's what this particular device does that's most impressive to me as a wound clinician especially.
It's probably symbolic of a lot of changes that are happening in healthcare, as we all, especially us guys in industry, try to figure out how to make your job as a clinician easier and your experience as a patient better. That's really what we're about.